आज आमच्यावर हॅलो दोतोर कार्यावरण आसात डॉक्टर आयरा आल्मेडा गोयचे नामनेचे पेडियाट्रिशियन तसेच वेगवेगळ्या विषयातले तज्ञ जाणकार. डॉक्टर, वन मोर थिंग आय वांट टू जस्ट आस्क यू. Commonly these days, because of pollution, first of all, I would like to know what is the reason childhood asthma is quite increasing in the magnitude. What is the reason and how to deal with it?
Yeah, it is true that childhood asthma is increasing, and
हे तुमचं एक स्पेशल म्हणजे you have specialization in this. That's
yeah, that is true. Yeah, special interest in it. It is found that as you know, the hygiene of a place improves, these type of diseases increase. This is mainly an autoimmune or chronic inflammatory disorder, as we call.
Okay.
So we see it mainly among the middle and upper socioeconomic people.
Yeah.
Now it is increasing a lot. You know, few years ago we hardly had any patients.
Doctor, I
with
can
asthma.
just interrupt you.
Yeah,
I
sure.
think we have got a question. Hello. Hello.
हॅलो.
हां, विचारात.
डॉक्टर.
विचारात. तुमचा आवाज क्लिअर आहे ना? विचारात. हां, विचारात.
हा डॉक्टर.
हां.
हा चल एक अभ्यास कर सांगला काय रोकडे रडपाक स्टार्ट करता.
केदे आसा भुरगे?
13 years.
अच्छा, किरे सांगला पण रडपाक सुरू करता? चॉकलेट दिता म्हणल्यार रडपाक सुरू करता?
ना ना अभ्यास कर सांगला काय ना स्टार्ट करता रोकडे अभ्यास स्टार्ट आणि मागीर अभ्यास केला बेश्टे आपल्या बरोवपाचें आहा म्हणटा. मागीर बरोवपाक बसता.
Okay, म्हाका दिसता this child must be having some learning difficulties. So ताका आवडना शिकपाक. So he is not enjoying it.
Yeah.
So we have to find out where his difficulty is. Just telling abhyas kar, you know, open the book and start, it is not
Sufficient.
yeah, it is not sufficient. So this patient should be referred to a child development clinic or to the counselor to find out where his difficulty is and then work with this child. This is a clear signal that this child needs help.
अच्छा. सो म्हाका दिसता डॉक्टरान सांगले तो एडवायस तुम्ही मातसो लक्षान घेवचो आणि सिरियसली ह्या विशयाकडे गंभीरतेन पळोवचें आणि डेफिनेटली यू कॅन फायंड अ सोल्युशन. करेक्ट. डॉक्टर, आमकां एक आनी एक प्रश्न आसा. हॅलो.
Hello.
हां.
Yeah, I wanted to ask a question to doctor.
Yeah.
Doctor, my daughter, she's 1 year 9 months, and she's not talking. She's not even saying her first word yet. So, what can be done for it?
Okay, 1 year 9 months.
Means how to go about the process?
Okay, 1 year 9 months. Generally, by 2 years, a child should have some words. You know, at 1 year, a child may be saying few words. We have what is called receptive language, and you have what is called expressive language. So, receptive language means parents will say "Sagle samjata पण एक शब्द उलयना." So, receptive means the child will, if you ask to get ना खंय, child will show, or अशें books घेतल्या अशें apple खंय, a खंय, the child will show, and the child understands what you are saying. So if the mother and child are talking, child will look at you, then you talk, child will move. So that is comprehension. But expressive language, by 1 year child is saying tata, child is joining two words, mama, dada, maka di, maka naka, and by 2 years there's a rapid growth. From few words, the child will speak many words. Now, if by 1 year 9 months the child is not speaking, definitely this child, we have to look why is there a speech delay. एक आम्ही autism, first question is rule out autism. Autism एक अशी condition है कि from birth there is it's a neurodevelopmental disorder where 3 things are commonly seen. One is there's difficulty in social interaction. You take the child in any social situation, child is very uncomfortable. There's difficulty in communication, so it presents as a speech delay, and there are odd or repetitive movements. So classically the child will not make eye contact, will not point, कितें जाय जाल्यार take the mother's hand to the biscuitry dobo अशें. And so we have to rule out autism. Once that is ruled out, a hearing test is a must. The sooner you do it, the better. Now, hearing test can be done in GMC, so you can take your child to GMC. Soon in the district hospitals also these tests will be available. And the therapy is to be started. We also have audiologists, even in Auspicio we have an audiologist where we give speech therapy. But as a parent, what you can do is, you can meanwhile till you do your tests, you can start by if your child is asking, first of all, you must talk slowly and in simple sentences. If your child is asking something by pointing or gesticulating, you, instead of giving him, if he is pointing to water, instead of giving him the water, you say, Tuka udak sai. So the child hears the words for it. And increase his vocabulary by showing books or board books with lot of things, so improves his vocabulary. But a hearing test and an evaluation in a center where this is there is a must, and speech therapy should be started as soon as possible, whatever is the cause.
डॉक्टर आमकां आनी एक प्रश्न आसा. हॅलो.
डॉक्टर नमस्कार.
नमस्कार.
माझो प्रश्न आसा साधारण 2 वर्षाचे भुरगे कितले निसपाक जाय, कारण थोडे आवय बापूय कितें म्हणटा तांकां जेन्ना न्हीद येता तेन्ना हे भुरगे न्हिजना म्हणून तक्रार करता. म्हणजे नॉर्मली हाऊ मच दे शूड स्लीप, and if they are not sleeping, what are the different reasons for that? Please explain.
See, normally children need have to sleep at about 2 years, 10 to 12 hours a day, and even it can go to 14 to 15 hours a day. These children will take a midday nap. So usually they will take a nap in the afternoon, but by 3 years they may give up that nap. But very important is, sleep is very important, and your concern is good, because at this time growth hormone is released, growth takes place, the child has to go through the 4 phases of sleep, and sleep routines म्हणजे ते सुरू करून जाय. First of all, there should be no TV 2 or 3 hours before going to sleep, because all those images in a 2-year-old child तांकां अशें डिस्टर्ब जाता. They may get dreams अशें त्या टीव्हीचे अशें लोक येता. They cannot understand logical thinking म्हूण ना. So you should have no TV before sleep, and have a sleep routine where you read to your child, then the child, you sing to your child brushes the teeth. So these are all messages to the brain that now it is time to sleep, and it is a wind down time.
ओके. मास्टर डॉक्टर आमकां आनी एक प्रश्न आसा. हॅलो.
हॅलो.
हां.
हांव सई उलयतां म्हापशेच्यान. डॉक्टर, म्हजे चली आतां 1.5 वर्साचें आसा, आनी ताका आतां दांत येवपाक लागला, सो ताका पेन जाता. सो डेंटॉनिक बीन दिल्यार बरें आसता?
See, normally 1.5 वर्षाचे, by 13 months the first tooth comes, and as such teething causes teeth. लोक समजता की अशें दांत येयल्यार लोक भुरगे अशें रडटा, संडास जाता, अशें दुसरे प्रॉब्लेम्स, थंडी जाता. But these are all associated. At that time, these are coincidental events. Now, when the first tooth comes, the mother should start cleaning the teeth. You have to clean either with a handkerchief, you just clean the tooth. And as the teeth come up, you have to use non-fluoridated toothpaste, because children like to swallow the toothpaste. Fluoride is good for the teeth, but if they swallow, then there's a risk of fluorosis. So after the age of 3 or 4, then you can use fluoride for the teeth. And there is no need of this dent tonic and all these things. Teeth will erupt on their own. They are waiting. They are all there in the gum, primary dentition. It will come out. Now, when children go to school, and what you put in your tiffin is very important to their dental hygiene. म्हणजे अशे cakes आणि biscuit and chocolates कितें अशे processed नी sticky hard boiled sweets केन्ना अशे ते दिवप ना. You give them whatever अशे, some people say तशेंच tiffin हाडटा परत, chapati नाजाल्यार bread जाल्यार अशेंच हाडटा. Then you give what the child likes, but in small amounts. So half apple, नाजाल्यार banana, chiku, fruits are best. And after they have eaten that, also a katlik kudko gailarni, the child chews it, and there's lot of salivation, and the teeth get cleaned. Or little body shape. But do not put any sticky things. Even nuts are alkaline, so it helps, and it decreases the acidity of eating anything that is processed. Or fruit juices also should not be given, because they are very acid.
डॉक्टर, म्हाका दिसता तुमी बरीच मोरादीक म्हायती दिता. आय थिंक आमचे पळोवपी आसात ते फॉलो करतले. वी आर टॉकिंग अबाउट अस्थमा.
Okay, yes.
What are the
like you
causes?
said,
Yes,
asthma is on the rise, and we find that you know, now a lot of people get so worried and confused, so they move from doctor to doctor. Then they don't know whether they need to start inhaler therapy, or the inhaler therapy is started म्हणजे pump, पण तांकां भिरांत दिसता सोय जातलें तशें, and then they stop it after 1 month. So for that reason, we have actually now starting an asthma clinic in our hospital, which is in the afternoons, where people who are in inhaler therapy are called. Now in asthma there are 2 components, म्हणजे अशें ते respiratory tree कोय आसा ते there is muscle around it, ते अशे टायट जाता. कितें इन्सांट आयल्या, cold air, नाजाल्यार pollution, नाजाल्यार infection in smaller children, ते tight जाता, and thereby the inner lining becomes thickened. And that causes the secretions, kuru, that causes the secretions to go on. Now, when we give treatment, we aim both at the lining, for which we use steroids, and for the tightness, the muscle around it, we use bronchodilators, म्हणजे aspirin, albuterol, salbutamol, नाजाल्यार that is same thing is given by nebulization. अशे वाफ दितात कहे, mist करून. Now, if we have got certain criteria that in the case of asthma, cure na, control asa. So, we want a child to be controlled, and that means the child is wheeze free, can take part in all the sports possible, and is able to lead a normal childhood, and does not require frequent admissions, and his growth is normal.
Correct.
That is our aim. So, towards this, we have got certain criteria where you have mild intermittent asthma or grade 1, or mild persistent asthma where it comes like say more than 2 nights a week, or more than 2 nights, 2 times in 2 days in a week is wheezing, or more than 2 attacks a month. This is the time we will start inhaler therapy, which is 2 types. One is you give prevention. So, preventer therapy is steroid, or you use reliever therapy. He is on the preventer therapy, but tori पण अशे tight जाता, कुंकू जाता, they can give a puff of the reliever, which is the aspirin or salbutamol or whatever. केन्ना मातशे serious asthma आसा, ते combination मेळटा, combination of these two which can be given. खूब लोक अशे worry जाता की सोय जाता or ना. But it is when we give a puff, it is only a better method of delivery. If we give medicine also सोय जातले.
बरोबर.
It's the same thing.
डॉक्टर मातसो इंटरप्ट करून
Yeah,
तुमकां
tell
हांगा
me.
एक 2 कॉल्स. हॅलो.
हॅलो
हां, विचारात.
हॅलो
हां, विचारात.
डॉक्टर मडगांवच्यान उलयतां,
हां,
सोनाली कवळेकर.
सोनाली बाय प्रश्न विचार.
डॉक्टर म्हजो चलो न्ही 1.5 म्हयन्याचो आसा, आनी तो रातचो न्ही चडशेदा कंटिन्युअस असो 2 बी मातसो जाग आयलेलो कंटिन्युअस 4 पर्यंत 5 पर्यंत असो न्हिदत ना.
दिसाचो न्हिदता आसतलो.
दिसाचे न्हिदता अशें स्लीप सारकी सावंड स्लीप कशी लागना ताका, म्हणजे हालोवन न्हिदयलो जाल्यार सकयल घातलो की परत उठता. पण रातचो न्ही कंटिन्युअस एक 4-5 दीस तसोच करता की न्हिदत ना, कॉलिकेट घातले तरी थांबना.
नाही, बेसिकली दिस इज अ रॉंग कन्सेप्ट. मॅडम, यू एक्सप्लेन.
1.5 month child, usually they get what is called appetite spurts. म्हणजे त्यांचे भूक वाटता. This can happen if a baby is breastfed, and it can happen at 4 weeks or 6 weeks. So 1.5 महिने म्हणले. So that time baby gets up to feed again. And this is the way to step up milk production. म्हणजे चोखता तितले दूध भरून येता. So mother who was producing 400 ml at birth and at 1 month will now produce 800 or 700 ml if the baby keeps on sucking. The other reason, like she said, is could be gas, which is called evening colic. It starts from 1 month till 3 months. It may go on. And colicate, she has given colicate, it has not helped. And those things only help to absorb the gas. Once the gas comes out, baby is fine. But the thing is, because baby is crying, baby is swallowing a lot of air, and म्हणून चोट gas asa. Main thing is, put the baby back to the breast, step up the milk production, and baby will be fine. And ani ek gost asa that it is true. Sakal dole bhurge rotta because they are used to the uterus warmth, and this is their position. They are not straight like this in the uterus, so they are not comfortable. If you cradle them in your hand, bari asa. And that is why you see these people, these gypsies and all, bantani, they put like a hammock and they roll their babies even in the train. The child is very happy to have that position. So this problem 2 महिन्यान अशें वेतले, पण आता सध्या परत दुधाक दोल्यार baby will be fine.
डॉक्टर आमकां आनी एक प्रश्न आसा. हॅलो.
हॅलो. हॅलो डॉक्टर.
विचारात.
माझी एक भयणीची चेडूं आसा न्हू, 4 वर्सां जाली तेका बस किंवा हे बीन लागता तेका डॉक्टर. म्हटल्यार खंयसर गेले न्ही 2 व्हिलर जावं 4 व्हिलर सुद्दां ते ओंकता मागीर वाटे. अशें कित्याक जाता, कित्याक ते उपाय कितें अशें?
Motion sickness. Okay. कितें जाता न्ही, some children are more sensitive to movement. So these children, you should not allow them to look at the side because the image is moving very fast. So if they are sitting in a car,